How do 4 common sleeping positions affect your health? Sleep. Is there anyone in this life that doesn't need sleep? The average person spends 25 years of their life sleeping. This is necessary because a reasonable rest regime is very important for health. A good night's sleep brings many benefits. It not only helps the functions in the body to be regenerated, but also makes the brain work more optimally. Many studies show that the majority of people sleep on their side, about 50%, and on their back, about 40%, and 10% of people sleep on their stomach. Unfortunately, the position you feel most comfortable in can cause health problems, from aches and pains to sleep apnea. So, learning about the pros and cons of common sleeping positions can help you reduce their harmful effects. For the question, which sleeping position is best? In my opinion, sleeping on your back is the best and most applied position. Because it will reduce the pressure on internal organs, does not affect bones, joints, respiratory system. However, for people who snore, sleep apnea, this position will make the condition worse. Here are the effects of your sleeping position on your health. Number 1. Sleeping position on your back. Sleeping on your back offers the most health benefits. Not only does it help protect the spine, but it can also help relieve hip and knee pain. As the Cleveland Clinic explains, sleeping on your back uses gravity to keep your body aligned with your spine, helping to relieve unnecessary pressure on your back or joints. In addition, sleeping on your back will help protect your skin from any wrinkles caused by pillows or body gravity. To get more benefit from this pose, place a pillow under your knees to help support the natural curve of your back. Of course, there are some potential downsides to this pose. Sleeping on your back can be difficult for people who snore or have sleep apnea. It can also be uncomfortable for people with back pain, which is why we need good support from a pillow. Number 2. Sleeping position on one side. Statistics show that this is the most popular sleeping position in humans. Overall, this is a pretty healthy pose and doesn't do much harm to the body. Sleeping on your side will help reduce snoring and sleep apnea. However, in some people with arthritis, sleeping on their side can cause back or shoulder pain, but this is not necessarily a big problem, because when we sleep, if we have mild pain or fatigue, we will often automatically change positions unconsciously, helping the body to avoid pain. For people with gastroesophageal reflux disease, sleeping on the left side can improve the condition more or less. A small harm of sleeping on the side is that our facial skin is more prone to wrinkles because the skin will be pressed to one side and stretched over time. For pregnant women, sleeping on their side and knees bent helps to reduce the pressure of the abdomen, creating conditions for blood to easily circulate throughout the body. Besides, pregnant women should choose to sleep on the left side to reduce pressure on the liver and help blood be transported easily to the heart, kidneys and fetus in the uterus. Number 3. Sleeping position on stomach. Sleeping on your stomach is a less common sleeping position and is not recommended for most people. This position can make your sleep uncomfortable and increase pressure on the spine. In the long term, sleeping on your stomach will negatively affect your spine as well as your skin, causing acne and wrinkles because your face is often pressed against pillows or mattresses. Although sleeping on your stomach has more disadvantages than sleeping on your side or back, if you like sleeping in this position, experts recommend using a thin pillow for your head or not using a pillow to help your neck stay comfortable. At the same time, if you are pregnant or have severe neck and back pain, you should absolutely not sleep on this position to avoid health risks. Number 4. Sleep in fetal position. There are many ways to sleep on your side, but many people find it comfortable to slightly bend their knees toward their chest, similar to the fetal position. More than 40% of people sleep in this curled side position. Fetal sleeping position is the most popular position. It is not only comfortable but also helps to relieve back pain and reduce snoring. This pose is great for you if you are pregnant. This is the most common position for women. They are twice as likely to sleep like this as men. Fetal position helps you breathe easier. In addition, many studies show that lying in this position helps you reduce stress, depression, and be more alert the next day. The disadvantage of this side position is that it causes the spine to curve too much, which can cause tension and discomfort in the neck and back. Lying tightly rolled up during sleep can also limit space for the diaphragm and breathing. If you have neck pain, this position can put pressure on the joints near the skull, making neck pain worse. Although comfortable, you should use a pillow under your head to ensure proper neck and spine posture. In addition, people with back pain should put a thin pillow between the knees to be able to keep the spine more comfortable.